Hi, everybody. Welcome. I'm Dr. Izabella Wentz, PharmD, and today I've got Dr. Kirk Gair, one of my really good friends, here with me. And Dr. Kirk Gair is an expert in laser therapy, so we're going to be talking about that. I'm so excited to have him here. Welcome, Kirk. How are you doing?
Thanks, I'm doing great. How about yourself?
Very good. Thank you. Thank you so much for taking time out of your busy schedule for getting together for a little while to chat.
No, happy to do it. I'm excited.
Awesome. So let me give you guys a little bit of background about Dr. Kirk Gair. He was actually in the same class with Dr. Datis Karazian, and together they trained in functional medicine and neurology. Dr. Gair was one of Dr. Datis's, original guinea pigs.
Yeah.
He was the first person to get a functional blood analysis from him. And Dr. Gair has been using cold laser since 2004 on professional athletes, actors, and patients of all ages. In 2011, his life changed when an iodine contrast caused a thyroid storm in his wife that was life-threatening and ramped up an undiagnosed Hashimoto's into really high gear, affecting her brain as well. So since that time, he immersed himself into functional medicine and cold laser methods to help get her life back on track from this devastating illness. And now he shares this information with the thyroid community in order to help others. So, I just think that's amazing what you've done for your wife and what you're now doing for thyroid patients worldwide. So thank you for your work. I really appreciate it.
Well, thanks. I'm happy to help, and happy that I was able to help my wife. If nothing else, that was worth going to chiropractic school and learning about lasers. Things kind of come full circle. Yeah.
Yeah, absolutely. And I think it just makes you so much more of a passionate and caring, healthcare professional when you have that personal connection like you do.
Yeah. Absolutely, I agree, because you know what patients are going through firsthand, and so many patients go and they say, "Oh, my doctor doesn't really understand me." And when you've got someone close to you that's going through potentially one of the worst versions of a Hashimoto's experience, it really helps you connect more with other people, and they know that you really know what they're going through too.
Mm-hmm. Absolutely. And, my husband, Michael, has just been a tremendous support in my life. And I just think for anybody that's going through any chronic illness, having a great partner on board is just so important. It can be the defining difference of getting better and just staying ill. And I think you're a true testament to that with your wife's story.
Thank you. Yeah, and that's so true, that I see a lot of patients that if they don't have that support network, it's just hard to make much progress. They're stressed out all the time. It ramps up their autoimmunity. So you're right, having a good husband like you have, or a good wife, is really important.
Mm-hmm. So tell us about your wife's story. What was going on in life, and what did she experience, and how was that handled in the hospital setting?
What was going on with my wife is, for a while, she was just having, the general Hashimoto's symptoms, but wasn't really getting diagnosed. Lower energy, weight gain, some brain fog, things like that. And when she was going through to get some tests done, she had a CT scan with an iodine contrast, and it was within about a day. She said she didn't feel right as it went into her veins. She didn't feel right then, but I remember the next day she was lying down, taking a nap next to me on the couch, and she woke up gasping from the nap because her heart rate had kicked up to about 170 beats per minute, and her blood pressure had skyrocketed to over 200, over 120. So it was really high, danger of having a stroke. So we actually had to go to the emergency. So, of course, at emergency, what do they do again is they do another CT scan with iodine. So it ramps it up all over again. And at the time, she was going to Harbor UCLA and getting checked out by the doctors over there, which are some of the top doctors in California. And they really didn't know what was going on. So she saw a neurologist there, cardiologist, other kind of experts, endocrinologists, and all of them were just like, I don't get you. This is just weird. We don't understand what's happening with you. She was at the point where she couldn't even get out of bed, trying to get up and walk across the room. Her blood pressure and heart rate would just skyrocket. She'd get vertigo and dizziness. Trying to go downstairs, she couldn't do that also. We have 2 stories in our house, and for several months she was trapped on the upstairs level, because if she tried to go downstairs, her heart rate would kick up and it just wouldn't come down. That's the other thing. Normally your heart rate will kick up and it'll come back down. With hers, it was just staying high. And even if she just watched TV, if there was fast motion going on, that would kick up the heart rate. If you tried to go out and drive in a car, I'd have to go really slow, not do any fast turns, because that could kick up her heart rate. So she had all these seemingly bizarre symptoms, these neurological symptoms. She had the brain fog, her personality changed. She was really anxious. She'd wake up gasping at night, couldn't sleep but was exhausted. Hands and feet were soaking with sweat. And then she was losing weight rapidly, very quickly. So fortunately, because Dr. Karaji and I had gone to school together and we were friends, I was able to call him up on the phone, which is pretty unique because, you know how busy he is. But I was able to call him up, tell him what had happened. And it was amazing because on the phone, he right off the bat knew what it was. He said, "Oh, look, this is what happened. She had an undiagnosed Hashimoto's going on beforehand. When we put the iodine into her, it triggered a massive autoimmune attack on the thyroid, and that started to dump a bunch of thyroid hormone at once, and this was ramping her up." And the other thing he said was going on is that with a lot of the Hashimoto's patients, they'll also have antibodies against the brain. So that's what could affect her GABA pathway, so she couldn't put the brakes on the heart and on the blood pressure. So I was able to take her in, get her checked out by Dr. Karaji, and we did all the tests on her to see what food she was reacting to. She was highly reactive to gluten, to milk butyrylin, which is a protein found in milk. So we strictly eliminated all of those things. We had to work on the blood sugar because her blood sugar was tanking out. She was going hypoglycemic. She had some anemia going on as well. And then I had to work on her brain with doing these laser techniques to try to heal up that pathway, so that way we could actually, the first step was just getting her to be able to go downstairs. I remember that first day when she was excited because she said she was actually able to go downstairs and come back up and not have to wait like an hour in between. So that's where she was, which was really very scary, especially when every endocrinologist, she went to 3 different ones, and they all told her the same thing. Well, this doesn't make any sense. Your TSH is not bad enough to medicate you. You have high antibodies, but we don't do anything for antibodies. So that's kind of where we were with her.
Wow. That must have been really, really scary for both of you guys. It's just like all of it. She had these subtle symptoms, and all of a sudden it's like she was debilitated.
Yeah, it was life-changing because prior to that, she was working with me at the office. She was running everything at the office with me, managing it, and she literally went from being somebody who could be doing a lot of work to being to do nothing. I mean, where just being able to go downstairs is a big deal. That's quite a change in your life, especially when you're only 40 years old. That's quite a disability. Mm-hmm. And especially when you're not getting any help from traditional doctors, when they just look at you like you're crazy and pretty much tell you, "I don't get you." That was probably one of the most difficult things, especially as we're getting the heart checked out. The cardiologists, they couldn't figure out where it's coming from. They're like, "We don't understand. This is not coming from the heart." It wasn't clear enough to them what's going on. And thankfully, from I learned with Dr. Karaji with the functional neurology, we were able to recognize that it's coming from the brain. That's where the issue was coming from. So we at least knew what was the source to help her with. And I see a lot of patients in my office that come up with the same symptoms that have gone through that same loop of not getting any help, and the foods are not being looked at, the brain's not being looked at, and they're just kind of lost.
Mm-hmm. So with the CT scans, is that routine for them to use iodine in the contrast? Or if somebody has Hashimoto's, should they be avoiding CT scans? What do you think?
I really think that they should, because after this all happened, then I started going on PubMed and trying to read as much research as I could about why did this happen. And it was one of the things that really disturbed me, because there's ample research that says that a Hashimoto's patient, if they have iodine contrast given to them, it can trigger a life-threatening thyroid storm. And there's a decent percentage of people this can happen to, that I really think they need to change the way they do this. I think they need to screen for the antibodies before giving someone iodine. And if someone has a Hashimoto's antibodies, I think they should use an alternative type of a contrast medium, because the risks are too high. And after I posted a post about this on my Facebook page, I had dozens of readers send me messages saying, "You know what, as I trace this back, my whole problem with Hashimoto's really ramped up after I had iodine contrast." So I think it's very, very common. I think people need to be cautious and ask their doctors about some alternative types of contrast they could use.
Right, because there are going to be alternative types of contrast that can be used. So I would say for anybody with a history of Hashimoto's or family history, so if you know that your kids are going in for this, or perhaps your elderly mother or somebody in your family that's related to you, if you're a Hashimoto's patient, always make sure that they're asking for the type of contrast that's being used, because if you're using iodine, that can create a potentially life-threatening situation.
Yeah, and you get so much destruction of the thyroid gland from that. And that's just a massive attack that happened. She would even have the feeling like she was choking because the thyroid was so inflamed and swollen from the iodine. And they did it to her 3 times too. So, it's a tough lesson learned, but hopefully we can get that message out to other people so that they can avoid the same kind of situation.
Yeah, absolutely. So I think that's a really, really important thing. And for people that have gone this route and have found that post the CT contrast, they just were never quite the same, there's actually hope, because your wife is, you're able to reverse so many things for her. Now you guys are playing tennis together, right?
Right. And of course, like anything, there's good days, there's bad days, things go up and down, but it's much better. I mean, she can go on long car rides now. She can be out for a lot more hours during the day. It's much better than it was. So yeah, there is hope. You just got to keep looking for the right help and the right combination of things as well too.
Mm-hmm. And you had been working with lasers for quite some time, and there's some interesting research with lasers and the brain. So your wife had been having some brain symptoms. Can you talk about those and how you were able to use lasers to help with that?
Sure. So like when I took her into Dr. Karaz, he's one of the world-renowned experts in functional neurology, besides functional medicine as well too. So he did some simple functional tests, and this is something a person can even do at home to kind of see how their brain is functioning. You can do some simple balance tests, just standing with your feet together and trying to close your eyes. And so she tried to do that. There'd be a big sway going on, trying to do like a drug test, basically the field sobriety test. Mm-hmm. A lot of patients who have these antibodies against the brain, they'll fail that even without any alcohol, because the cerebellum's not functioning right and they're not getting good information for proprioception for where their body is in space. And so you can do these simple things like standing on one leg and trying to balance with your eyes open first. A lot of patients can't even do that. And trying to do it with the eyes closed, a lot of them will fall over. So she was having some stuff like that. And again, another thing we learned is that motion sickness. A lot of people say, "Oh, I've had motion sickness my whole life." Well, Dr. Karajian told me that's actually diagnostic, that there's something going on with the brain. There's inflammation that's going on. That's not normal. A person who's really ticklish or has, especially in the feet, that's another thing that tells you there's some inflammation going on in the brain. Somebody who says, well, gosh, if I go to like an IMAX theater and if there's a lot of motion going here, I feel dizzy and I feel just, out of sorts, or my heart rate ramps up. Those are all signs that there's something going on that they need to get checked out. So those are the things we worked with. And what I would do with the laser is I would actually have her do some things she had trouble with, and then laser over the cerebellum or laser over the prefrontal cortex to try to stimulate some improved function in those different areas. And I did that on a daily basis with her. Fortunately, since I have a laser, I could just do it every day for somewhere between 2 and 8 minutes while we're stimulating those pathways, and then having her do exercises as well too to try to strengthen those pathways. So those were the things that I did with her. And with each person might be different, because you can take 10 different people who have these symptoms going on, and they'll have different pathways that are being affected. Some people, it might be an auditory pathway, or it might be a balance pathway, or it might be eye movements. So that's why it's important to also have a doctor who knows what they're doing with that, evaluate the patient, so they know which pathways to work on.
Mm-hmm. It's really fascinating, the connection between, like vertigo and motion sickness and seasickness. When I was I've gone on boats. I used to have a jet ski, and I've gone on all kinds of roller coasters as a kid and teenager. And then I think it was my 26th birthday, I told Michael that I didn't want to go drinking on my birthday because I didn't want to be puking, right? And so he took me on this beautiful boat ride in Los Angeles, and I got really, really seasick. And that was the first time that had ever happened. And, shortly thereafter, I was diagnosed with Hashimoto's with antibodies in the 2000 range. And once I got my Hashimoto's into remission, there was a time where I was like really afraid of going on boats, but now I can go on them without any issues. But it's just amazing the big connection we have between those things, right?
Yeah, it totally is. I remember we went on a cruise in 2009, my wife and I did, and she wasn't diagnosed yet either. And I remember on the cruise, she was just wiped out. She just couldn't, she just felt exhausted. And we now know why. It's because, the brain wasn't processing the information properly. So it was making her exhausted. And, it would be years later that she actually had the full-blown reaction that she did. But there were those signs leading up to it that people can pay attention to those things and get help before it becomes a big crisis. Because if you don't do the things necessary, it does progressively get worse, and you can cross a point where, you can't make as much recovery on it, or the recovery is much more difficult. So it's important you get on top of those things as soon as you can.
Yeah, it's kind of, I think it can be scary because, when I was first diagnosed, I was sort of kind of like a wait and watch approach where I didn't really take a lot of action. So I was doing, I was just doing a lot of research and doing a lot of reading, but I wasn't really taking action. So it took me probably 1.5 years to implement the gluten-free diet, even though I saw all the public research. And so whenever people have these kind of brain things and scary things happening, I think it's a really good indication to see a doctor like yourself who can specialize with this and really help to sort these things out, because it gets progressive if you don't address it, right?
It does. I have a perfect example. I had one patient, he'd been a long-term patient of mine, and he came into the office and he thought he'd had a stroke, because when he was speaking, he actually sounded like he was drunk. His speech was very slurred. And he told me over the weekend he'd gone to the ER, he'd seen the neurologist, he'd seen all the specialists there. They ran all the scans on him. They said everything was fine. It was just stress, is what they told him. I knew his family history, so I told him, I don't think this is stress. I think you've got some other autoimmune things going on. Let's get some testing done. So I ran the test on him to see if he was reacted to gluten and to gluten cross reactors. And he lit up on that Cyrex test on the Array 3, 20 out of 24 different gluten reactions. And on the gluten cross reactors test, he lit up majority of those ones too, especially this milk butyrylphyllin one on there that will hit the brain and hit the myelin sheaths. So I had him go 100% gluten and dairy free. He was real skeptical about it. I told him, listen, just give me a couple of weeks to do this. So he went 100%. Within a week, his speech cleared up. Went back to normal, almost normal, like 90% of normal. So I see him on a Friday. He sounded pretty good. He comes back on a Monday, and he sounds like he's been drinking again. So I asked him, okay, what'd you do on the weekend? What happened? He said, well, I had a cheeseburger at work. And so I asked him, well, how long was it after you had that cheeseburger before you had the slurred speech? And he said it was within 20 minutes.
Wow.
Have the slurred speech. And there's other neurological issues he's got going on, but that's an example of a person where he's got reactions within 20 minutes of eating a food. Yet the downside is, here's somebody who's got some severe symptoms, but he still keeps eating cheese and ice cream, and even though it slurs his speech. So sometimes, even when you have these strong symptoms, some people still kind of don't really understand the gravity of it, to where you're actually destroying tissue. If you're eating gluten and you reacted to it, you can be destroying thyroid tissue that you can lose forever. In this case, you're destroying brain tissue that could be gone forever, and you can reach a point of no return, to where you've destroyed so much tissue that you've got some permanent deficits. And you really, if you have these reactions, you got to be 100%. You got to stick with it, as you know.
I agree. And, people can say you can take glandulars like thyroid glandulars, but there's no brain glandulars out there, right, that we can take. And so...
Well, you can actually. There are some things you can do to help with these brain pathways. Dr. Karazian has created a whole bunch of them. But the thing is, you can't just go and here I'm tired, I'm depressed. Let me take this to support my dopamine pathways, because who knows, is that really what's going on? So you really want to do a proper workup on there. Proper questionnaires. He's created some really good metabolic and neurological assessment questionnaires. That's what we use in the office. We do that. We run the blood test, and we run the food reaction panels, and we put the person through the functional neurological assessment test was affected, and then definitely we do support whichever pathways are affected. And obviously some things like good amounts of EPA and DHA, having that amount in there for proper brain function, that's very important. Making sure the blood sugar is balanced, that's super important. Making sure you're not anemic, because if you got low iron, you're not going to get good oxygenation to the brain. So there are things you can do to help it. But if you are reacting to those foods and you keep eating them, there's no substitute for eliminating those foods. Just like, as with the thyroid, if we got someone who's reacted to gluten, and you can do all the supplements in the world, you can do all the thyroid glandulars, but if you don't remove those foods, you're still going to be destroying tissue either in the brain or the thyroid. And you got to do both, really.
Mm-hmm. Yeah, I totally agree. And it's just, for me, it's not even worth it. And there's so many great substitutes out there that it's just becoming easier and easier. I feel like people really need to understand how important it is to follow the right type of diet for you, so that you don't continue to give yourself more damage. And you don't have to listen to what the commercials say, or, I used to get all my nutrition information from Subway commercials.
Right. Of course.
Yeah. You can be a rebel, do what's right for you. Don't do what's right for the masses, or what you think is right to feed us. Right.
Right. Well, I think one of the biggest things we run into too a lot is we've been so programmed that, you need a cheat day. or I want to have a cheat. It's okay. If I do average. A lot of times I run into that with patients. They're like, well, I'm mostly gluten-free. And I actually did this to Dr. Karaji. When my wife got diagnosed, she went 100%. I fooled around with it. Even though, like you, I read all the research, I still thought I could get away with things. And then I talked to Dr. Karaji about it, and he asked me, well, are you gluten-free? And I told him, well, mostly. He said, no. He said, it's like having a baby. You either are pregnant or you aren't pregnant, and you either are gluten-free or you aren't, because just one exposure to it, you could flare up your antibodies for 6 months to a year. And I didn't really think about it. I thought, wow, just taking one little cheat could cause me to attack the thyroid in the brain for the next 6 months to 12 months. And I think that's the hardest thing, is getting people to understand that it's because they're used to thinking about just weight loss. And it's like weight is the last thing I'm worried about with the patients. It's keeping the brain healthy and keeping the thyroid healthy. That's the most important thing.
Yeah, I would totally agree with you. It's like, we are programmed that we are supposed to have ice cream when we have a bad day, or we're supposed to have donuts and whatnot, all these quote unquote comfort foods. But, really they're just going to make us feel worse in the long term. And it's like when you've been, I recently had somebody ask me if they can just do, the paleo diet 5 days a week and then whatever they want on the weekends. And I said,
weekends, right, exactly.
That's not going to work. That you're just going to be taking a few steps forward, and then on the weekend you're going to take a few steps back. And
right.
So it's just, you really need to go all in for, I would say, at least, give yourself 30 to 90 days of trying this type of diet to see if it makes a difference for you. And some people can reintroduce certain foods. So, gluten and dairy are the biggest ones that I recommend getting off of. But then some people might be sensitive to eggs, and, every now and then you can reintroduce eggs back. But, it's just a matter of really being kind to yourself and taking that opportunity for you. And, of course, if you have a supportive spouse, it helps. But every now and then you might have to just really put your foot down with your friends and family and let them know, like, hey, this is the diet I need to eat. Otherwise my thyroid numbers go off, or I start having these brain issues. Like, anybody can get that if you explain it to them that way.
Yeah, exactly. And like you said, on the foods too, some people even react to rice. I had this one kid come in. He was a Division I scholarship running back, and he got diagnosed with rheumatoid arthritis. And no one in his family had it except for his 90-year-old grandmother. He got it at 19 and could barely walk when he came in. And so I ran he came in just for a laser initially, but I told him, we got to test your food reactions, see what you reacted to. Of course, he was highly reacted to gluten. He was also reacted to whey protein. And what athlete is not eating whey protein? And he was reacted to rice. And this kid's background was he was Japanese, Mexican, and Creole. So he had rice on all different aspects of it. And so he said it was be a real challenge for him to give it up, because it's in part of all of his heritage and culture. But he did, and the great thing is he was able to get back to playing college football, whereas he could barely walk when he came in. And that just shows you that it could be something that seems like a normally healthy food, like whey protein or like rice. And just, there's all these differences from individual to individual. Some people just eliminate gluten, and it's like world of difference. Other people, you got to eliminate all the grains, you got to eliminate yeast, you got to eliminate nightshades, you got to eliminate all kinds of stuff.
Yeah, that's right. And, whey protein is considered such a great health food. And I used to have a whey smoothie every morning, and I thought I was doing all the right things. And it turned out I was so sensitive to whey, it was causing me to have acid reflux, irritable bowel syndrome, and carpal tunnel in both of my arms. Like,
so miserable.
Yeah, so miserable. But one of the things I was really, really excited to talk to you about also was something that I've been really researching for the last few years and kind of guinea pigging myself with. And that's something that is your area of expertise, is actually using cold laser therapy for thyroid patients. Can you talk a little bit? I know we talked a little bit about different types of studies that were done in Brazil that showed that some people, about half of the people who had a specific cold laser treatment saw a reduction in thyroid antibodies, and then they also saw elimination or a reduction in the need of thyroid medication dose. You've actually been doing that in practice. Can you tell us more about that?
Yeah, I mean, I obviously I started with my wife and myself as guinea pigs. For me, I only had elevated antibodies. I never had the TSH go out of range. But so we started using that several years ago. And let me show you this book here. This is since you said there's going to be other professionals that are looking at this. If anybody's looking at stuff, I don't know, can you see that there? Yeah, it's going to be backwards. But this book here is a really great resource because you can see how thick it is. These are all the reasons on what cold laser can do. So there's literally thousands and thousands of them on here. So I started just combing through all the PubMed and through this book to see what you can do with lasers. And what you can do with lasers is it will actually modulate the immune system response. So you can actually help with tumor necrosis, transforming growth factor beta 1, which has been shown to actually modulate and improve autoimmune thyroid patients. Even with Graves, there's even some research studies with that, because you can actually modulate its activity. When we're doing this on the brain, it actually modulates the activity of the glial cells. So this way they're not overreactive. They're actually targeting the cells that do need to be destroyed and not targeting the healthy tissue. The other thing the lasers can do on the thyroid is going to improve blood flow. You're going to increase antioxidants like glutathione. And glutathione is really, really important for all aspects of the body. And so you can wrap up the glutathione, which also helps to protect against the autoimmune attack. It was showed to help these people stay off their meds for, even 9 months for some of them at follow-up. And on ultrasound, even the tissue on ultrasound looked improved in the studies that are listed on there. So you get a lot of different improvements without any side effects, because a lot of people think, oh, you're not supposed to irradiate the thyroid with a laser. And that could be true if you're using a high-powered laser that's transferring a lot of heat. When we're looking at the lasers that I'm talking about, that are the cold lasers, the lower level lasers, we're doing something called photobiomodulation. So what that means is that your body's going to take the energy from the photons. It sounds like something from Star Trek. You take energies from the photons, and you're going to transform them into something else. You're going to transform them into ATP. So again, we're using the thyroid or the brain as an example. If you get increased ATP production, you get increased energy in the cells, and so you get improved function. You're going to get increased nitric oxide production, which is going to dilate the blood vessels. So you get improved blood flow, which again, that's going to help the thyroid. That's going to help brain function as well too. You're going to get a decrease in the inflammatory cytokines like Th17. That's going to decrease. You're going to get increase in the anti-inflammatory cells. So you get all these different benefits without any side effects, as long as you don't use a really high-powered laser. If you use a high-powered laser that transfers a lot of heat, yes, that could be contraindicated for the thyroid. So we use these lower-power lasers to do that. And we only do them for a couple minutes. Some of the treatments, some of the studies I've seen have benefits after just 5 seconds. Some of them are after a couple of minutes. So that's where there's a lot of confusion with lasers, because you have numerous different wavelengths, numerous different milliwatt settings, time settings, etc. So there's not a gold standard of exactly like specific wavelength, a specific frequency, specific time. So there's still a lot of learning that's going on, a lot of experimentation on what's going to work. But if you use the lower ones, they're not going to do damage to the thyroid, and you get a lot of benefits with it. The other thing we'll support with that too is that we'll do laser over the liver, again, to also increase glutathione and decrease inflammation on there. So those are a few different things we do with the lasers, and we've seen benefits in patients' function and my function, my wife's function as well too.
And thank you for clarifying that, because I feel like a lot of times there will be warnings on specific laser therapies or even LED devices that they should not be used over the thyroid gland. And when I was first starting to reach out to some friends in the medical device industry about using lasers for thyroid, they were like, you mean like laser ablation, or like basically destroying the thyroid with the laser? And I was like, no, that's the opposite of what we want to do. So it's really important to note the type of laser that needs to be used.
Yeah, exactly. And the key thing too is when we're looking at laser, we're not really necessarily treating a condition. So it's not like we're fixing Hashimoto's with using a laser. It's kind of like what you talk about in the root cause. We're getting to what are the underlying dysfunctions, and we're trying to support those pathways. So that's what we're doing with the lasers. Is it's not necessarily a specific treatment to cure Hashimoto's or something. We're trying to improve, antioxidant levels, trying to improve blood flow, trying to improve cell proliferation, because that's one of the things you get with a laser when you're using these lower level lasers with photobiomodulation, is you actually stimulate the tissue to repair and regenerate at a much faster rate. There are some studies that are I've seen on PubMed and also in this book that suggest that lasers can actually stimulate some stem cell production as well too. So those can differentiate that into different tissues, and so that's one of the benefits you get with laser as well.
One of the things that I found, and sometimes in people that have Hashimoto's, sometimes you do the right things, they get off of gluten, they, treat different infections and so on and so forth, and you'll see a regeneration of their thyroid tissue, and they can get off of their thyroid meds. And I used to, younger people who had the condition for a shorter amount of time, But
Right.
I've had people who have been older and have had it for 20 years, and this has surprised me. And then I've had people who were just diagnosed and you did all the right things, and they still could
Yeah.
not generate thyroid tissue. So this is a really, really amazing new intervention that can be tried for people.
Yeah, exactly. I'm excited about it. The possibilities are endless. We even have been doing work with a lot of patients, even with severe brain traumas in the office, with patients who've had strokes, who had concussions. I work with a lot of athletes as well, too. And you can see amazing changes very fast, to where it almost freaks people out at how quickly you can get some of these changes when you're using the laser on the brain. So it's pretty exciting. And again, the thing I always look at when we're doing a therapy is, what's the risk to benefit ratio? It always has to be considered. So when we're looking at lasers, there's a very low risk on there, really, other than just damage to the eyes if you concentrate it and hold it in the eyes. But with other tissues, there's really not that much risk if you're using the appropriate dosage. And that's a key thing too, is in our culture, we tend to think that more is better. So, hey, if 2 minutes works, then let's do 20 minutes, or let's do an hour, let's do much more. And we find out with lasers, it's actually not true. There's like this bell-shaped curve that you can reach a maximum improvement right here. And then if you start trying to do more laser, you actually get a negative impact. So whether that's using it on the thyroid, or on the brain, or on hair, you can actually start to inhibit different activities, and you can actually create inflammation. So that's why it is important for people to understand what they're doing with the laser and use it appropriately.
Mm-hmm. One of my friends, Dr. James Carroll, he's a laser specialist like you. He kind of gave me an analogy when I was first discussing lasers with him, and he said it's kind of like baking.
Yeah.
So, you have to have the temperature. If, let's say, you're baking for 400 for 20 minutes, that's not the
Right.
same as baking at like 200 for 40 minutes, or 800 for 10 minutes. Like, you're going to have completely different results. So it's really important to know
Right.
that you have the right kind of settings, because you can have completely different outcomes.
Yeah, that's a perfect example that you give, because there are a lot of laser companies out there that will pitch their product saying, this one's the most powerful laser. It's got the highest milliwatts, so your treatment time can be a lot less. And that's the thing, is it's really intense. It's also like going in for a massage. Let's say you go in and someone just right off the bat just digs right into you and puts an elbow as hard as they can. Your body's going to fight that pressure. Whereas if they kind of come in a little more gently, there's less resistance to the body. And that's the same thing that happens with lasers. There's a thing called the Arndt-Schultz law, that when you have a really high-powered laser coming in, the body can actually resist it. The tissue can actually become resistant. Whereas if you get those right kind of Goldilocks kind of settings on there, then you have a better effect on the body without the negative repercussions.
And so you cut out for a sec. So you were saying when you have these high-level laser, the body can become resistant. Is that what you said?
Yeah, I said the body can become resistant if it comes in too powerful. It's like a massage that's really, really deep and hard. The body can resist it. And same thing with those high-level lasers. Did you hear me say about the Arndt-Schultz law? Did you hear me?
Yes.
Did you hear me? Okay. So that's what can happen, is the tissue can become resistant, and now you don't get the benefits that you would with a lower-level laser that's doing the photobiomodulation. Because the other ones that are really powerful, you get more heat. So those can be beneficial for pain relief. That's where they're really good. If you got someone with osteoarthritis and you're just trying to relieve a painful joint, those high-powered ones are pretty good for that. But when we're looking at photobiomodulation for the brain or for the thyroid, the studies show that actually less is more, lower power is better. Some of the optimal settings I saw for the brain turned out to be about 1 joule per centimeter squared, which is real, real low. And if you start getting too high, you actually create more inflammation, and you can actually activate the immune cells to start attacking the tissue more.
Yeah, you definitely don't want that. And Dr. Gair, you're doing training for practitioners for lasers as well. So you're doing that in 2006?
Right. We're going to start that next year in 2016. We're going to do some webinars and also some trainings at my office as well, too. We don't have the date set just yet, but if people want to know when they're coming up, that's going to be at erchonia.com, which is ERCHONIA.com. They'll have the dates up there once we get those finalized.
I will definitely be there. So I will be there with my notebook and pen in hand, maybe even glasses.
Okay, cool. Sounds good.
So another thing is, with hair growth lasers, and I have one of these nifty little
That's awesome. That's so cool. Right.
Can lasers actually help hair growth?
Yeah, they can. It was actually one of the first findings they had with lasers, clear back in the 1960s. It was an accidental discovery. They were doing some experiments on rats to try to see how lasers could help with wound healing, because that was one of the first things that lasers were investigated with. And a lot of people think, oh, lasers are new, but they're really not. Been around since the 1960s. The Soviet Union was way far ahead of us in that, so there's a lot of research from the 60s and 70s on it. And so anyway, they did surgical incisions on the rats' abdomens, and they accidentally found that the rats that were lasered had tremendously greater hair regrowth than the non-lasered rats. So yeah, it worked for that. There are studies that show that it works for alopecia areata, even for resistant patches. There's one study in the book that I showed you earlier that they had 16 different females who had 34 different resistant patches who did not respond to any kind of normal treatment for alopecia. They did laser on them, and all but 2 of the patches resolved. So that's a pretty powerful study on there. They even did it with male pattern baldness as well too, and it showed benefit with even male pattern baldness for hair regrowth, for thickness of the shafts, and for the number of the follicles as well. So yeah, there's a lot of good stuff with the lasers as well too for that. Even the LEDs have shown to be effective as well. I know a lot of people have a question: what's the difference between an LED and a laser? And the interesting thing is, all these studies, even when they use like a sham laser, just light itself has an effect on the tissue. So even if it's sunlight, obviously that has effect on our body for melanin production, for vitamin D, etc. And so when we're using an LED or a laser, we still have an effect on there. It's just there's a little difference in how it modulates the tissues on there.
Mm-hmm. Yeah, and I wanted to actually ask you, with the different types of devices that can, I guess, provide you with photobiomodulation. So LED versus laser, when would you use one over the other, or do you only use specific types of devices in your practice?
That's a really good question. In my office, I'm a little biased because I use mostly Ergonia products. Not saying that those are the only ones that work, because when you look at the research, it shows benefits with all different kinds of wavelengths, all different kinds of settings, and milliwatts on there. I just like their products because they have really good research behind them. The company's been around for a long time. They were the first ones to ever get FDA clearance for a laser product back in 2002. So that's why I like them. But any laser that you use, even a laser pointer, is going to have an effect on the body. So in my office, I like using true lasers. For a patient for home use, you could get away with LEDs. They do have an effect on them. They're a lot less expensive. They're still going to have an effect on the tissues. But I think that the research shows that there's a much bigger effect when you look at a true cold laser versus an actual LED, because an LED is still not coherent light. It's still incoherent, and there's a difference in the energy and the photons of energy that come from a laser versus what comes from an LED. So that's why I prefer lasers, and if someone has the finances to get a laser, I would recommend getting an actual true laser over an LED. And
so then with the way that I understood it is that the lasers can actually go in deeper into our bodies where the LEDs may not. Is that a correct understanding, or is that a little simplistic?
No. I mean, it's a controversial one, because you'll hear people from different camps argue deeply over this. So it's a great point you bring up. Like, you'll hear some people who have the really high-powered laser will say this one penetrates much deeper than a low-powered laser. Then say like there's class 2s, class 3s, class 4, which really relate to what the potential eye damage is on them, what the potential power is for the laser. So when you have these higher power ones, they'll say it can penetrate deeper. But if you look at the research studies, there's some fascinating things that are shown. Like they've done some studies on rats where they'll injure both legs. They'll do like a crush injury, or they'll sever the sciatic nerve on both sides, and they'll only laser one side, like say they'll only laser the right leg. Well, what they find is that not only does the right leg improve, the left leg also improves too, faster. So the laser is not staying localized. You're getting a global effect on it. And when you do put laser on the tissue, you're also irradiating the blood vessels. So you're getting an immune response. You're getting a change in actually the lymphocytes, change in the energy in the blood cells as well. So it goes globally around there. The bigger difference with the LEDs is just the wavelength and the frequency has a different effect on the tissues. I saw one one quantum physicist was talking about it, and her opinion was, she said, it's like the lasers are speaking the language of the cells. So when you have a particular wavelength, a particular frequency, you're actually kind of telling the cells what to do. And that's one reason why there's a difference from one laser to the other. Like with the Zirconia ones that I have a highly programmable laser to where I can enter many different frequencies in there, because they'll have different effects on the body depending on what frequency we input. So I have different frequencies I put in for hair regrowth versus for the thyroid versus for brain.
Wonderful. And yeah, I think it's really interesting the different effects that lasers, it's really interesting the different effects that lasers can have on the body. And you know, I'm really, really grateful for you doing this work and being a pioneer in this and sharing your information with us. What if a person wanted to get their own device? Would that be allowed, or what kind of recommendations would you make for them? Because I know some of these things are only going to be sold to practitioners only, which actually is a pretty good idea, because you can potentially hurt yourself if you're not using it correctly, right? Right,
exactly. So yeah, that's an excellent question. There's a really good book too that's written for lay people by Dr. Norman Deutsch called The Brain's Way of Healing. And if you look at chapter 4 that he writes there, he cites a bunch of different research on lasers for the brain, and also his recommendations that every person, or at least every ER, has a laser to work on patients when they have a concussion or traumatic brain injury or stroke, and eventually with the hope of every person having their own laser, because then they could do things on a daily basis. So if a person wants to get them, if they're getting an LED, obviously you can order that off of the internet. But to get a true laser, you usually have to have a prescription from a doctor, so that way you can be trained in how to use it. I have patients, like when I have patients that are very chronic, I recommend them to get a laser, and I can just give them a prescription, and I put them in contact with Zirconia. They are more expensive, you know, like the ones from Zirconia are going to range in the price between $7,500 and $10,000 for the laser. But it's a really, really high quality laser with a lot of different frequencies, really good warranty, and it's good. Company's been around for a long time. There are other lasers out there that you can get for, you know, $1,000, $4,000. All lasers have some effect on the body. I like looking at how long has the company been around? Does it have a warranty? What kind of support can you get? Are you going to get trained by a doctor who actually knows what they're doing? Because sadly, I'd say most doctors who have lasers have no idea what they're doing with them. They buy a laser for the hype, excited about thinking it's a magic cure-all for whatever ails you. You just stick it on there and it fixes it. And they don't have much more knowledge about the laser than the average patient walking around. So that's one of the factors on there. So I would get myself educated. You know, you can read some of the research studies on PubMed, and you can do some of the training. The webinars that we're going to do some free ones as well too, you know, so you can check those things out. But usually with the good lasers, it's getting a prescription from a doctor to do it. Got it. So then a doctor can actually prescribe a laser for people that they can use. So
Correct. They can see a doctor that's trained in laser therapy and maybe get started that way, or do all their sessions. But if they have a chronic issue, perhaps they can get a prescription, and then they can get started off and then train on how to use it on their own if it's something that they need to use, you know, on a daily basis or a few times a week, where it's just not reasonable to go in and to see a doctor every day, right?
No, it's not. It's not cost effective a lot of times, especially let's say if there is a brain issue. Like let's say with my wife, definitely if I have a patient who comes in who's got the neurological issues that she does, and I have a lot of them, and a lot of them that come in have no idea that their brains are not functioning that well. Sometimes we'll do a simple test, like just having a person try to count backwards from 100, subtracting 2s, and then subtracting 5s and subtracting 7s. And you can see they can't even do that, and they can't do these balance tests. If I see something like that, usually for a patient like that, I would recommend them thinking about getting some form of laser, if not the one that I like, you know, getting some other one that they can use on a daily basis, because it's going to save them money in the long run. And obviously they're going to have that condition for the rest of their life. You know, you can put it into remission, but it's still there and it can still come back. So you want to work with this all the time, especially with the brain, because, you know, that's controlling everything. That's controlling your gut. That's controlling your immune system, all these different things. So yeah, I think it's a good way to go.
Yeah, and I think the research that I've looked at talked about doing, you know, treatment doses, and then you want to do maintenance doses as well.
Correct. Right, exactly. So like, again, going back, using my wife as an example, we started off doing treatments every day for several minutes. And then we're now able to space them out a little longer. And how long you space it out, that varies from person to person. You know, a lot of times people know, like I'll have patients go, hey, I need to come back in. I'm just feeling a little off. I'm not feeling as, you know, as good as I normally do, or my balance is a little off. I'm kind of banging into things. And then we'll do the laser therapy on the brain to get them tuned up.
So when we were hanging out at the Thyroid Mastermind in Boulder a couple of weeks ago, you actually brought your laser and you did a couple of different, sessions for volunteers that were there. And I noticed that you actually did the laser therapy in a couple of different spots. So can you talk about how you would approach a Hashimoto's patients with where you would treat them with the laser?
Sure. What I do when I'm doing like the Hashimoto's patients, if we're just trying to support the thyroid function, we actually laser over the thyroid itself. We'll do that for about 1 to 2 minutes on a low setting on there. I'll also laser over the thymus. There's some studies that suggest by lasering over the thymus can actually get some good immunomodulation for kind of calming down the autoimmune attack. We'll do a little bit over the liver, again, to try to ramp up the glutathione production. And then when I'm doing the brain pathways, as you notice, I was stimulating their eye movements, stimulating their hearing, getting them to do tongue movements, mouth movements, etc. I'll usually do it over the brainstem. So I'll do it over the cerebellum, or the back of the neck, while I'm stimulating whichever pathway is not firing properly. And we'll even also go straight through the mouth and in through the nose as well too, because you can really get it can kind of saturate the brainstem going through that direction on there. So those are the areas that I do it. When I have patients who are using their own laser at home, I have them do just 2 minutes over the cerebellum, 2 minutes over the right side, 2 minutes over the prefrontal cortex, 2 minutes over the left side. That's a real simple, basic way we can have patients do it. Now, the interesting thing is, again, in the studies, they find out that when you put it on, it spreads. So do you really have to put it on one particular area? I like to do it just because I like to kind of get that target tissue more than, trying to just have it spread from somewhere else. So that's a protocol that I use.
Okay, amazing. Very cool. And that's not in, if people are looking at PubMed, this is brand new information that they're not going to see, but this is something you've tested with your patients that's worked out really well.
Right, exactly. If they go to PubMed, they'll find a lot of studies on there. It'll tell them the wavelengths of the lasers, but it doesn't really tell you how they were applied. Some of them will tell you they were applied. Like there was one particular one that said they applied it over the jaw because it was after a dental procedure, and then over the jaw had no impact on the thyroid. Whereas the other ones that I saw, when they did do it directly over the thyroid, that's where you saw thyroid and thymus. That's where they were able to measure improvements on ultrasound of the tissue and the blood flow in the thyroid.
It's fascinating.
It is.
Yeah, thank you so much for being here and for sharing this information. If people want to get more information about you or your work, where should they go? And then do you have anything exciting to share with us?
Okay, sure. For more information, they go to my Facebook page, which is facebook.com/thyroidinfo. They can go onto my blog site, which is just Dr. Kirk Gair. That's KIRKGAIR. I also have my chiropractic website, which is laserchiropractic.net. So you can see I've been doing it for a long time to get that URL. I also have some free giveaways. I've been working on some relaxation music. I'm going to do some basically some meditation CDs as well too with this. So it's music that I've written and composed. But I also have some ocean sounds because, as you know, stress is a huge factor for a lot of autoimmune patients, and even just soothing sounds, soothing music can actually affect your brain waves, kind of calm them down. So if they go onto my music page, which is reverbnation.com/KirkGairDC, there's some free downloads on there or some music that they can use to kind of help them unwind and relax.
And I'm going to spell that. It's www.reverbnation.com/KIRKGAIRDC. And yeah, this is definitely going to be something that's going to be really helpful for reducing stress, which we know is a huge trigger and exacerbator of Hashimoto autoimmunity.
Right, exactly. Yeah. And I'm working on a book as well too. That's a long process, as you know.
Yes.
So that'll be in the future. So if people want to sign up for my email list, they can do that on my site.
And that's going to be the drkirkgair.com site. And then you're actually collaborating with your wife on your book to share the journey that you
share the story. Exactly, because my wife, she's got her master's in clinical psychology. So she really had to use a lot of her training to help deal with, how an autoimmune disease like Hashimoto's changes your life. And so that's what we're going to incorporate. We're going to incorporate both things, both her story, what she did to work with the psychological stress of dealing with this, and then incorporating the treatments that I do.
Okay, well, I can't wait for that to come out. So please keep us posted.
Definitely will.
Okay, well, thank you so much, Dr. Gair. It's been such a pleasure to have you, and I really appreciate you sharing your expertise with me.
Well, thanks for inviting me. It's an honor to be on your site. I've been following you for a long time, so I feel really honored that you thought of having me as a guest on your site.
Oh, absolutely. And I've been a longtime fan as well. So
Great.
anyway, guys, I hope that you found this interview helpful. So I hope everybody has a wonderful day.
Great. Thank you.